Acute coronary syndrome describes the range of myocardial ischemic state. There's three types, so there's unstable angina, non-ST, elevation myocardial infarction, and stem 1, and ST segment elevation myocardial infarction, stem 1. Acute coronary syndrome occurs as a result of buildup of fatty deposits or plaques in and on the walls of the coronary arteries. When the plaque deposit ruptures or split, a blood clot forms, reducing blood flow of the blood to the heart muscles. That will cause low supply of oxygen to the cells. The cells of the heart muscle will then die, which causes heart attack. However, if there's no cell death that occurs, this is called unstable angina.
When doing an assessment on the patient, we first need to obtain subjective and objective data. For subjective data, which is non-measurable data, we use information such as the daughter reporting that her mom has become increasingly weak over the past couple of weeks. For objective data, which is more measurable data, we use information such as vital signs, which is her heart rate being 100 or BP being 146 over 92. Lastly, for assessment of the patient, we need to obtain a nursing health history. For example, the patient is a 63-year-old Hispanic woman with a past medical history of coronary artery disease. We review patient records, review nursing literature, consult support people, consult health professionals, use other data, and analyze that data.
According to ACC guidelines, the first step in assessing patients with chest discomfort or other symptoms is determining the likelihood that symptoms and signs will represent acute coronary syndrome. By assessing the patient's signs and symptoms such as her chest discomfort and her past medical history of coronary artery disease, we can determine that the patient is more likely to be experiencing acute coronary syndrome. It is important that we review and discuss the findings to the physician. The patient support system will include family, which is her daughter, friends, and other resources such as community support and services. It is important that we communicate to both the patient and her daughter, encourage them to participate in the plan of care we're doing. We have to provide appropriate teaching to promote the patient's healing process. Lists of community support and services should also be provided, where the patient can gain more knowledge about her disease, how she can manage it, and it is also a great way to socialize and to learn from other people suffering with the same disease as her. Priority problem in this case study is chest pain and shortness of breath. It is important that we identify what is causing the chest pain in the patient, and this can be done by collecting a trove of clinical history and a physical examination and supported by ECG. The patient is suspected of acute coronary syndrome, therefore we have to communicate that to the physician. Collect vital signs and laboratory values will also help the doctor with providing a diagnosis and a plan of treatment. ECG can help and diagnose an acute coronary syndrome by measuring the patient's heart electrical activity. Blood tests should also be done for certain enzymes that may be detected in blood. If cell death has resulted in damage to the heart tissue, a positive result will indicate heart attack.
Mrs. MM has edema and abnormal vital signs and laboratory results. For example, her sodium is slightly low. She is also experiencing clammy skin and continuous vomiting. These are all indications of worsening symptoms of ACS.
Okay, so for plan, it is important that the medication is prescribed by a physician so that she can take to prevent the pain. Educate the patient on how to stay physically active. Eat heart healthy foods. That is important for a patient who has coronary artery disease. Maintain a healthy weight. Encourage fluid intake. And monitor EKG. The reason why I say monitor EKG is so we can look for the cause of the chest pain to evaluate problems which may be heart related, such as severe tiredness, shortness of breath, dizziness, fainting, etc. To identify irregular heartbeats. And EKG will also record the electrical signal from your heart to check for different heart conditions. So for goals/outcomes, prevent your condition from worsening. For the patient, she has had swelling in her ankles and feet by late afternoon so much that she couldn't wear her shoes. So improve your health and quality of life. Enable the patient to achieve his or her goal, hers or her optimal physical, psychological, social, and vocational functioning through exercise and lifestyle change. Educate the patient. As a nurse, it is very important for you to educate the patient.
If this were my patient, my first concern would be the patient's shortness of breath. In this case, I would position the patient in a high sitting position because this will allow the patient to breathe a bit better, as this helps open the airway. Then I would follow with vital signs and pain assessment. In this way, I can identify ways I can manage patient discomfort. For example, if the patient's SpO2 is below 95, I would know to provide oxygen titrate as ordered by the prescriber. I would also want to monitor the EKG, as this will alert me to change in the patient's condition. Since the patient now is vomiting and has clammy skin, it's important to call the provider and notify them that there's a change in the patient's condition. As a nurse, I would hold any oral medications and possibly get an alternate route prescribed to administer any medications since the patient is vomiting. Secondary interventions include collaborating with the interprofessional teams, which include physiotherapists. A physiotherapist can provide support, prevention, and rehabilitation, and identify ways to manage pain. A occupational therapist can help Mrs. find ways to be productive and spend time with loved ones. A physician's role is to identify a treatment plan for Mrs. A social worker can provide psychosocial care and other services to the patient to improve quality of life. The charge nurse's role is to ensure Mrs. is getting the adequate care in the appropriate unit. Pharmacy's role is to ensure patients get the safest medication and the adequate knowledge on the medications. Home care coordinators are there to ensure that Mrs. is safe when she gets home and to identify services if needed. Dietitians are there to ensure Mrs. has a healthy diet, which is especially important for ACS patients. And lastly, the primary nurse is responsible for coordinating care. In addition, since the patient is vomiting, she's at risk of dehydration, so you'd want to monitor her intake and output and encourage fluid intake. Encourage her to increase her physical activity to prevent hospital-acquired edema. And lastly, it's important the patient receives her prescribed medications to help manage her symptoms, such as her shortness of breath, high blood pressure, chest pain, and her fluid buildup.
To determine if we have achieved the goals, we have to reassess the patients and check for the patient's current conditions. So we can do that by checking the therapeutic effects of the prescribed medications, or checking for the patient's vital signs, assessing for the patient's weight daily, and doing head-to-toe assessment, checking for presence of edema if there's any decrease in size, and also checking for any signs of adverse effect that have occurred. So that can also be done by checking the patient's vital signs, again head-to-toe assessment, and checking the ordered laboratory results. More, it is important that we assess the patient's knowledge about the medications prescribed by the physician. They have to know about the name of the drugs, the frequency, administration routes, and as well as the dosage. They have to know about what are each medications for, and as well as the adverse effect as a result of taking these medications and how to prevent them. We have to address any concerns or questions that the patients have, and as well as her daughter, refer the patient to cardiac nurses or dietitian for advice, and primary care team for ongoing preventions. Furthermore, we have to provide the patients a copy of their discharge summary, and that will include confirmation of acute MI diagnosis, the results of the findings such as laboratory findings, future management plans, and prevention advices. Before discharge, it is important that we provide patient education, as it is necessary to prevent another reoccurring of her conditions. It is also important to include her family, her daughter, in our teaching, as she can help manage the patient's condition. We have to teach the patient regarding the medications prescribed by the physician, emphasize the importance of not discontinuing any medications without any medical advice. Advise the patient to develop a system such as drug chart to ensure that each medications are taken at the right time, as when they discard, they're going to be taking a lot of medications, and that will also help promote adherence. Educate the patients about signs and symptoms that indicate reoccurring or progressing heart failure. Advise to seek an urgent medical assessment If chest pain reoccurs, discuss the benefits of regular exercise and instruct the patient to plan a regular activity program. Instruct the patient to measure her weight in the morning daily after she has emptied her bladder. Advise the patient about cardiac rehabilitation and encourage her to attend it. Provide patients resources of cardiac rehabilitation she can go to that will include physical activity, psychological and social support, and support with her lifestyle changes. Teach the patients about the importance of lifestyle changes, and that will include controlling her BP, reducing LDL cholesterol and sodium intake, avoiding smoking if necessary, maintain healthy weight and maintaining healthy diet, restrict alcohol use to a safe level.
For this patient, there are a few social determinants that affect the patient for their treatment plan. For example, the first determinant is financial and social status, and this affects the patient because her treatments and medications are costly but are necessary to manage and prevent reoccurrence of these conditions that she faced. Another determinant is social and food insecurity, which is shown because she lives alone and has a daughter that cares for her by bringing her meals. The last social determinant is language barrier between the patient and the healthcare team, since the patient only speaks Spanish.